The CDC Foundation's work in funding community-based organizations across the country is really a new portfolio for us, but such an exciting one. We've been able to partner and fund community-based organizations across the country to do COVID-19 vaccine outreach, education, and access.
The best way to understand what's happening on the ground is really working with people on the ground and community-based organizations that really serve as that conduit to connecting local, state, federal, governmental public health agencies to the communities themselves.
And when you look at organizations across the country that have the capabilities to reach communities directly with a network of community-based organizations, but also be using the best practices, the best data, and really the best science, you really only have the CDC Foundation to look at right now.
We live in a very rural community in the coal fields of southern West Virginia. Being rural, we're often isolated, and for many of our seniors, we are sometimes the only human contact they have on a daily or even a weekly basis. So as COVID began to rage, that isolation increased even more, and I began to see a real cognitive decline in many of our seniors, as well as, increased rates of depression due to the isolation.
We were the first site where the first case was found. So the first noted case of COVID was someone who was from Auburn Gresham. At that time, we were already doing work in the community around health and wellness. What we noticed right away after the first death was that if this was ground zero for death, what was the impact on the rest of the citizens in our community?
Throughout this pandemic, Boulder County has been aware of fighting two pandemics, one being COVID and the other being mental health. We know that LGBTQ people are less likely to have a doctor, certainly less likely to have a doctor they trust. Without the support of the CDC Foundation, the next pandemic, we'd be sitting in the same spot. The funding has allowed us to begin the work of systemic change, where we're training all clinicians on LGBTQ language, LGBTQ issues related to the pandemic and vaccinations, along with immigrant issues, undocumented folk, and the disability community. So we're in this for the long run.
We have 80 employees, and I often tell our people, you are a great army of goodness. Go and do good. And the funding from the CDC Foundation allowed that great army to have more resources and to do more good. The CDC Foundation project allowed us to really start intergenerational programming that has been successful and that will continue past the grant date.
The CDC Foundation is one of our critical partners in helping us to address particularly emergency responses. CDC Foundation is well positioned to understand what the critical needs are during a public health crisis.
The impact of the funds from the CDC Foundation exponentially improved the work that we were already doing in our communities. Using local messengers are not just important for my community, they're important for every community. Proximity for everyone is the most relevant context for receiving information, for giving out resources, and for building trust. That's bar any demographic you have. Every community operates in that way.
Without this funding, our people would go without the basic needs and necessities they need to survive.
Without the CDC Foundation funds, we could not finance a team to do that immediately.
Donations to foundations are key, and the CDC Foundation is doing work in the realm of public health that no other organization is doing.